Perfect. Hi, everyone. Welcome to our YES series. Today, we have Denise Schwartz from the Manual Touch. Thank you so much for being here, Denise. Denise will be talking to us about how to heal our neck pain naturally. Denise has been giving us lots of advice for over the past 5 years. Is that right, Denise?
Well, it was before the pandemic because I came
Oh,
in
okay.
person, so 7 or 8 years maybe.
That's amazing. Ugh,
I don't know when
wonderful.
we started, 2017 or 18. I don't know.
We'll have to figure out how many people you've actually connected with. That's amazing. Well,
Yeah, that would be nice. Yeah.
yeah. Well, thank you. And I believe there'll be time for questions at the end, and I will let you take it away.
Okay. Well, good morning, well, it's not morning, is it? Good
Yeah.
afternoon. As Amy said, I'm Denise Schwartz. I'm a physical therapist, and I am gonna share my screen, and then I'm not going to be able to see any of you. So if there is a question, please put it in the chat box and or write it down and save it for the end because I won't see any hands. Let me see. I'm still getting my screen set up here. There we go. And I won't be able to see myself either. Okay. All right. Always got to get all this set up. Anyway, thank you, Amy, for having me. And as some of you heard, we were discussing, I have been doing these talks for the YMCA, I think since 2017 or 18, and we did them in person for those few years, which was wonderful. And it's so nice to be able to interact with people. This way, I feel like I'm just talking at a screen, which I am. It would be nice if we had interaction, but this is easier for all of us. I am the owner and physical therapist of the Manual Touch Physical Therapy and Wheeling. Uh-oh, hold on. Why isn't this going? My mouse isn't working. 1 second. Oh, no. Oh, there we go. Okay. All right. In Wheeling, um, we use a whole body approach of traditional and non-traditional therapy to get people back doing the things they love to do. Today, we're going to talk about neck pain and what you can get an understanding of your neck pain and what we can do for you. Okay. So, shortly after my son, right here, the groom, graduated college a few years back, he came to me and asked me to help him overcome some injuries so he can get back to triathlon racing. Now, Drew, who is now 28 and married, as you can see, and that's actually my daughter over here. She was the best person. And that's his wife, Victoria. But he started doing triathlons at age 14, and he soon was winning his age group in every race he entered. And then he went on to compete at a junior elite level when he was in high school, and then at the collegiate level for college, becoming nationally ranked. And those of you who don't recall what a triathlon is, it's a three-sport race. The athletes first swim, then bike, and then run. And he wanted to make and he took a couple years off after college, nursing some injuries and getting used to adult life. And when he came to me to ask him to get him ready, race ready, he decided to make his return at the Pleasant Prairie race in Wisconsin, where he would first swim. Here's an example of a bunch of junior elite racers jumping into the water. And he at the Pleasant Prairie race, he would swim half a mile in a small lake, bike 12 miles, and then run a 5K, which is 3.1 miles. The first thing we did is I videotaped him running on the treadmill to take a look at his running form. I then provided him with some running form tips and some exercises to help him rehab his injuries. But most importantly, what I did was I provided him with a lot of reassurance and encouragement that he could make it through this process. There was many a night he'd call me and say, "Oh, now my calf hurts or my hip hurts." And I'd have to talk him off the ledge and let him know that this is normal and he can still keep training, or maybe we need to back off a little bit. So we kind of tweak it, whatever we needed to do. The Pleasant Prairie race is unique. Oh, here's triathlon here. There's biking and then running. So the Pleasant Prairie race is unique in that it attracts a lot of para athletes. These are athletes with disabilities. I saw people running with the prosthetic blade. I saw people biking with their prosthesis and without their prosthesis. A disability might be blind, and so they have somebody on the bike with them. And then I saw athletes being carried into the water because they couldn't walk, but they could still swim. Now, my son's rehab took maybe about 6 months to get race ready, but these para athletes, I know it took much longer. Whether they were born with a disability or came on later in life as an adult, their first goals were not necessarily to do a triathlon. It would be, learning how to function with their new limitations and a new disability, how to sit and how to get from one place to another, how to toilet and how to get dressed. And then as they would go along in the rehab process and those things become okay, they can build bigger goals and they learn to accept their disability, but they don't let it define them or limit them. But they understand what they can and can't do, which is a really big important piece when you're going through some pain or injury, realizing that there is a normal healing process and it can take time, and understanding what your limitations are, what you can and can't do at the moment, but you can set these goals. And so it's so wonderful to watch these para athletes competing in a race that they may never thought that they could do, but now that they can. And when my patients can meet goals like that, it's just wonderful. And it was so wonderful to work with my son and that he trusted me to help him with this process. Now, maybe you're here for neck pain. Maybe your goal isn't to do a triathlon, although I do have triathletes in their 70s still doing that and still running. Maybe you just want to walk. So I have my patient Marla, who had her neck, she had chronic neck pain from a car accident she had many, many years earlier, maybe 30 years, and she's in her 60s. And her neck would hurt worse after walking. And when we discussed it, she tended to be a power walker, really powering along. And I said, you're really not strong enough to do that. And so then your neck had to work really hard to stay on your body. So I told her to slow down. She hated it, but she did. She slowed down significantly, took her time, and her neck didn't hurt worse after walking. And as she got stronger, she could increase her speed. So sometimes you just need to make an adjustment in your normal routine. Maybe you want to get back to golf or be able to cook or just hang out with your friends, but without pain. So we work on figuring out what those goals are. Right, so today we're going to talk about the 4 common causes of neck pain that I see. Discussion about anatomy, some education about anatomy and how does your neck work and how does it integrate with your body and what your choices are. So your 4 common causes are arthritis or stenosis. So those of you who may have had long time neck pain, maybe you've already had MRIs or x-rays, and maybe you've seen the word spinal stenosis or foraminal stenosis. So we'll discuss what that is, or you've had a herniated disc. Those of you who've had pain and you've had a bunch of tests and they don't come up with any answers, it's because it's probably a musculoskeletal problem. You have a weakness, postural weakness, or you have like a mobility issue or joint limitation that I call skeletal problem, which doesn't show up on any pictures. These are frustrating for people, but they're the easiest thing to take care of. Common complaints that everybody has. Sometimes we can discern a diagnosis based on these complaints, but it's kind of across the board. People might come in with neck pain, or they have arm pain, upper back, head pain. You might have numbness or tingling in your arm. You can't move your neck as much as you used to, headaches, dizziness, weakness, and difficulty doing various activities, reading, sleeping, driving, walking, etc. This is an ebook that I have created, Mindful Tips for Daily Movement, because sometimes you just need to make adjustments to what you're doing throughout your day. So if you put your first and last name and your email in the chat box, I'll be happy to send you a copy of this. All right, so let's talk about neck pain and anatomy. This is your spine. This is your skull. This is your cervical spine or your neck. There's 7 vertebrae. And then your mid back is called your thoracic spine. There's 12, as there's 12 pairs of ribs that attach to those vertebrae. And then the low back is your lumbar spine, which there's 5 of them. And down below is your sacrum, your coccyx, and then your pelvis here. You can see in this picture that so here's the front of your body, right? You can see the mouth. This is your back. In the front of the vertebrae, between what we call the vertebral bodies, are your discs. Behind the discs, between the body, and this is called your spinous process, your spinal cord runs down from your brain, down all the way down here, and it ends around here, and it becomes another type of nerve, it's still your spinal cord down in this area. And in between each vertebrae are a set of nerves that come out on each side. The front this is showing you the front of your neck. And what's really nice about this is people don't quite realize that your rib cage, it feels like it's almost all the way up into your neck here. Here is your clavicle, your collarbone. This is your first rib. Okay, so that attaches to the first thoracic vertebrae, and just above it is your cervical spine. The upper part of that thoracic spine moves with your neck. So these first few ribs play a big role in when you move your neck. And I get a lot of people where they get so when people come in and like, I slept funny and I can't turn. It feels like my neck is locked up. It's actually the joint movement between this first rib and the thoracic vertebrae has gotten kind of stuck. It's not moving like it needs to. And it's pretty simple. And that's the ibuprofen doesn't help it. You don't see it on x-ray. Exercises don't do it. Somebody needs to get in here and kind of get this joint moving, and so your body can start moving the way it needs to. This is a side view of your neck, and here you can see it a little bit more closely. What's interesting about this also, and I want you to see in relationship, here is the top of your neck, your cervical spine, and that's the base of your skull. Your ear sits almost on top of that, and look at your jaw is right here too. So sometimes people come in with pain in their ear, into their jaw, and we have to discern, where is it really coming from? It could be coming from your neck, and all the restrictions and tightness going on in here is pulling into here, or vice versa. You could have a dental problem, you could have a jaw issue, you could have an inner ear issue. So it's really important for us to figure out where is it coming from, and it could be a combination of all of the above. This is the yellow spinal cord coming down from your brain, down through your vertebrae. And you can see the nerve coming out through in between each vertebrae. Where it comes out between each vertebrae is called a foramina. So those of you who have seen foraminal stenosis on your MRIs, whether it's in your neck, the cervical MRI, or the lumbar, they're also called foramina. So stenosis is the actual definition is a narrowing. So it's really an arthritic condition where the bone here is built up a little bit and it's impinging on the nerve as it's coming out. If you have spinal stenosis, you have a narrowing of the canal that the spine is going through, and it's usually compressing the nerve right where it's coming out of the spine. If you have a herniated disc, usually, so the disc here is, it's like a jelly donut. Inside the disc is a nucleus, and that nucleus is like the jelly part. And when that herniates, it kind of oozes a little bit and bulges on the outside of the disc, and that is compressing the nerve. People with a herniated disc usually will have a lot of the numbness and tingling down their arm. My brother his arm was falling asleep, and he needed a shot of steroid to get in there to open it up. Sometimes that is needed. We'll talk about that a little bit later on. People with stenosis will typically have arm pain, sometimes numbness and tingling, but I see that more with the herniated disc. Usually they just have limitation in their neck moving. They have pain into their shoulder or up into their head. Another nice view of the spine where we've sort of cut off the outside and you can see the spinal canal here. Again, here's the skeleton of the back of your head. And I wanted to show this because this area is really important. There are these little muscles at the base of your skull that a lot of people get pain in, but these little muscles are so important. These little muscles are what tells your body, or the joint that this muscle is controlling is telling these joints where you are in space. And if you have very sensitive fingers, if you put your fingers at the base of your skull and you move your eyes, you will feel those muscles firing. These muscles aren't moving your eyes, but what they're doing is they are stabilizing your head on your neck when your eyes are looking in a different direction. So these are very important. So a lot of time people have pain here, and we have to kind of, and you might have vertigo, and it's an eye issue. So we got to look at the eyes in relation to this. I'm seeing a lot of people these days with hypermobility, where they have really flexible joints, particularly in their hips or their knees. They hyperextend. But in turn, this joint is a little hypermobile. And so these muscles are a little too stretched out and they don't stabilize their head on their neck very well. And so then they get pain somewhere. And we've been doing some certain kind of exercise to get this stronger here and really re-educating the body and how to hold your head on your neck. So very important. There are a lot of muscles in your neck and your head. I'm not going through them. Just wanted to let you know that you can get a soft tissue muscle strain anywhere in here. Whiplash. So whiplash is a strain of a muscle in the front of the spine. So if we go back, it would be a muscle here in the front. That's whiplash. Your head goes forward, your head goes back, and then it goes forward again. And it strains this muscle in the front, even though it may hurt back here. That's whiplash. And this picture doesn't show, well, it does right here. These muscles also can help you breathe. So when my daughter was 2, was diagnosed with asthma, I knew she was having a serious problem because she couldn't breathe with her lung as optimally with her diaphragm and her lungs. She overused these muscles and she'd get this, I don't know if you can see that, where they get a sucking into these muscles here. So some people, when they come in, they have this chronic neck pain. It's because they don't breathe as optimally as possible with their diaphragm and they overuse these muscles. So there's a lot of different things that could be causing neck pain and that are not going to show up on any pictures. This is a picture of your upper trap muscle. Again, people come in and this is, I have a lot of pain, and this is where they have it. This is a really big muscle, and it goes from the back of your skull all the way down to maybe T10 or 11, and it comes over here to your shoulder. This gets kind of tight and restricted. People like shrug their shoulder up and they get tense. And so a lot of times that's happening because there's a weakness down below, because you overuse up in here. It's a stress related, so we got to work on relaxation. It could be a strain. So there's a lot of different reasons, but that's not always the primary issue. There's usually something underlying. If you put your name, your first and last name and your email in the chat box, I'm going to send you a copy of this PowerPoint, so you'll get all these little pieces that I'm discussing without reading through each screen. Okay, so we talked a lot about all these different pieces. I actually talked about the skeletal piece, that first rib. I remember my patient that I talked about early on, Marla. She had chronic neck pain. Well, she actually came to me because she not only had a chronic 30-year thing of pain, but then she had a new issue that she came to me, which we call acute pain. And she had that first rib issue that I talked about, where the joint of the first rib was not allowing her thoracic spine to move the way it needed to. So we needed to get in there and mobilize that joint. I mentioned weakness up in the neck. My patient Kathy had postural weakness. And she was also a sensitive soul. And what I mean by that is I saw her, I think she had had a concussion a couple years earlier. And she also had all that pain in that upper trap area that we talked about. And she was always using this device, I forgot what it was called, Theracane, where she was applying pressure in there and trying to get the knots out. And she'd get deep tissue massage, and it just made her worse because she was very sensitive to that very aggressive type of treatment. What I found with her is that she was so weak down here that she was overusing her muscles up in here. And we needed to retrain her core to work and all the little muscles in her spine. And once this got a little stronger, her upper trap didn't have to work so hard to hold on her head onto her body. So it's really important to get strong, and it takes a while. This is your core that I just talked about that we had to really work hard on with Kathy. We have all your abdominal muscles. This is your six pack. You all have a six pack. It just shows up on some people visibly and others it doesn't. But you do have it. And then you have a deeper muscle called your transverse abdominis, which is a very deep muscle that wraps around your front of your abdomen and your back. And it's like your armor. And that actually should be engaged all the time. And so I teach my patients a little trick to feel what that feels like. You put your tongue on the back of your top teeth and make a TH or an S sound. And that's to teach you what it means to engage your core. And again, when I'm sitting here, it's that transverse abdominis is always engaged because I've trained it really well, or I've learned how to use it really well over the years. Posture. I can't tell you how many times people come in and tell me, oh, I have such bad posture. I don't like to say that people have bad posture. You have your body and it's unique to you. And everybody is doing the best that they can. And trying to stand up straight and trying to throw your shoulders back doesn't always work because people's spine changes over time, or they're born with something different, or they have a curve. And so you adapt to that. So it doesn't mean you have bad posture. It means you are compensating the best that you can. And then we work with you to get you stronger and work optimally with what the spinal structure you have that may or may not change depending on what's caused it or what's going on. This is your spine. If we took one of these rocks out and we had an instability here or something was out of whack, all the stones would fall down. So very important to work from the bottom up. And sometimes we have to work from the top down. And everything is connected. So my woman, Marla, whose neck hurt more when she was walking, we needed to look at what was going on down here and how she was moving and how hard her neck had to work on her body. I like this picture because I've been noticing this more and more and more. How many times did your mother or somebody tell you, throw your shoulders back, stand up straight? And then as we get older, as things change, we stand up, we correct even more. And then you know what? We're moving here, not here. And we get pain here, here, down in the low back. Look at this. Look at how it's pinching that low back. So, and a lot of times what we're trying to do is trying to be able to see something. So if things have changed in our spine, our head position needs to change in order to visualize things. A simple thing you can do, because a lot of people do this where they're moving here, is actually lower your chest a little bit, almost bring your shoulders forward. You will feel like you're rounding your shoulders, but you're not. You will look like this. That's another little tip. Okay. All right. Big issue with people coming in aging. Everybody's pissed off about aging, but it's better than the alternative. There's not much we can do about it. We get older. And as we get older, we lose muscle mass, we lose bone integrity. And because of that, we lose strength and balance and flexibility. And it's really frustrating. Doesn't matter what age you are. You could be 30, you could be 80. I hear the same complaint. I can't do what I did 10 years ago. We work with what you have. So remember my story of the para athletes. They had to accept their disability and their limitations, but not let it define them, which I think I forgot to say in the beginning. You don't let aging define you. You don't let your limitations define you. We work with what you have to the best of your ability. And we create new goals. My friend Carney doesn't let his age of 73 stop him from doing triathlons. These ladies I met down in Tampa when I was doing a half marathon. I think she was 70, and I think this was her 80th birthday, and she probably was in the middle. We were standing in line at Starbucks, and I heard their whole story. So this was the longest Starbucks line I was ever in. It was the day before the race, but they had already had medals because they walked the 5K that day, and they walked the 10K that day. And then they were planning to walk the half marathon the next day. They didn't let their age limit them. And you know what else they did? They walked across America. They told me that day, we're going to walk across America. And we stayed in touch, and they did. They walked, they put their toe in Jacksonville, Florida in the ocean. And over the next 4 months, they walked to midway through Texas. Then they took a break. I don't remember how long the break was. And then they came back to that point in Texas, and they walked all the way to San Diego and put their toe in the Pacific Ocean. They had, I think, 5 or 6 ladies, and they had a van, and they took turns. And so, they weren't all walking every leg of it, but they walked across America. So they did not let age limit them. They didn't let it define them. Again, may not be your goal, but we work with where you're at. It's really important. So I am a physical therapist. I think it's really important. And how do we know if physical therapy can help? Well, are your symptoms reproducible? So if you tell me my back and legs hurt me when I stand or walk for greater than 10 minutes, which I didn't mention before, that is a sign of stenosis. If you tell me it hurts when I bend over or when I'm sitting, that's usually a sign of a disc problem. So that helps me decide how we treat you. If you come in here and you're like, I don't quite know what it is, it hurts all the time, it hurts when I'm sleeping, sitting, standing, we got to look at other reasons. And that happened to me. I had back pain one day. I could run, it wasn't a problem. A few days later, it just kept getting worse and worse, and it was radiating to my abdomen. There was nothing I could do. There was nothing that made it worse or better. I couldn't sleep. It turned out I had shingles for a week before the rash showed up. So that was nerve pain that physical therapy doesn't typically help. Sometimes alternative therapy, such as acupuncture and some of the non-traditional things we do, could help, but ultimately it doesn't. But if it's reproducible, it hurts when I walk 10 minutes, and if I sit down, it goes away, that's reproducible. So what's the biggest mistake you can make? Ignore it. Let's do something. You could go to the doctor, and the doctor could offer you some medication, an injection, or if it's really bad, surgery, and there is a place for this. However, even if you get these things, it's really important to learn how to work with your new body or your new issue or what's going on. There's so much that people don't know. Nobody taught you how to sit down or how to walk or how to stand or how to bend over. We learned that in physical therapy school, And so I don't get injured when I work with people, but you need to learn how to do that. So we really want you to come in and let's take a look at what's going on. So when you come in for your physical therapy, your first time, we do an evaluation. And the first thing I want to hear is your story. I want to hear your history, every surgery you've had, every trauma, why you're here, what may have caused the problem, how long you've had it. And that's the first big piece of of your puzzle to solve, to find out what's going on. And sometimes we are the first person that has heard that whole story, because sometimes that scar tissue that you have in your abdomen because you had a C-section or your gallbladder out, which is causing a problem down in here, and then you strain your neck because this doesn't move well, they may not put those pieces together. In fact, I had a guy, where did I put him? But it doesn't matter. His name is Chris, and he came into me and he had two major complaints. His neck hurt and his rib muscle was hurting. So his chest or rib cage was hurting. And he went to the doctor, they did MRI, they saw some, I don't remember, herniated disc or something. He's like, I could give you a shot. But when he came to me, he told me he hurt himself turning or twisting. And the problem was his primary issue was down here. This was a secondary issue. So he could have gotten a shot here, and his neck might have felt better, but he would have kept aggravating it because the doctor didn't know to put the pieces together down here was affecting this. I treated his intercostal muscle, which was strained, which was not allowing him to turn or breathe really well. We opened that up. We got those joints moving the way we needed to. And then he could turn down here, thus not turning so much up in here, aggravating his neck. So it's really important. Sometimes you get neck pain. We got to look at where else it might be coming from and causing that neck pain. During the evaluation, we're going to look at your mobility, your strength, and poke around a little bit, kind of figure out where are the limitations, like we did with Chris, to figure out what might be causing that pain. A lot of times it's because an area that's supposed to move, like your upper thoracic spine, and it's stuck and the joints don't move. Think about your joint should move in all directions. That's joint play. And if it's not, then somewhere else has to figure out how to do it, and you overuse that other areas. So when we figure that out, we work on do some hands-on techniques to balance out those joints. Make sure you have enough joint play in there so you can move the way you're supposed to, so you don't aggravate somewhere else. We work on any soft tissue or scar tissue that needs to make sure that tissues are moving freely. We give you some strengthening exercises, balance, stability, mobility, again, to make sure you have enough mobility. And then most importantly, two most importantly things, neuromuscular re-education, getting your body to work together. Remember the dancing skeleton? Well, if your feet aren't doing what they're supposed to do, maybe your neck is working way too hard and you get neck pain. So we got to look at that whole thing and get it all connected. And then education. We want to teach you how to sit and how to stand and how to move and how to bend over. Things you don't think about, and how at 75 things are, when you're 75, you might have to do, not necessarily do things differently, but because you've been compensating so long, you're not doing it like you did when you were 2. So it's really important. And then we look for other causes like Chris, okay? And this is an article that I did about rib pain and thoracic pain or mid back pain, which may be leading to neck pain. And you will not see anything on imaging for this, but it's painful and uncomfortable. And so it's really important to look at those pieces. And he actually not only did neck pain, he had arm pain. So any good doctor is going to look at, if it's a zebra and there's a stripe, it's the neck, right? But they may have missed this is actually what led to that problem. But when we worked on this area, the arm pain went away and his neck pain settled down as well. Another woman, Lynn, 78 years old, had neck pain for many, many months. She went to a chiropractor and a massage therapist for 4 months without any change. That's a red flag. If there's someone is doing something, if you're doing a treatment for more than 4 to 6 weeks and you're doing the exact same thing and nothing's changing, it's time to look at something different. Her MRI of her neck looked okay. It was insignificant. She came to me, and after 2 PT sessions, I settled down her neck pain, and then I looked closely because I missed it too. Her shoulder was the real problem. She had a significant rotator cuff tendonitis and tear, and because of that, so to raise her arm, she had to overuse that upper trap muscle here, causing severe pain up into her neck, because you saw how big that muscle is. So it looked like she had a neck problem, but she really had a shoulder problem causing the neck pain. So it's really important to discern where is it really coming from. Again, yeah, see? So she had all this pain here that was radiating up into here, but it was because of her shoulder. We talked about all the education we teach you. And then I want to talk to you about a tool that I love to use with my patients. This is something I added in 5 years ago. This is called an OOV. And this uses your, doesn't allow your body to compensate. It activates your core subconsciously, and you can get on your back. I got it between the wall and this gentleman's back. You can stand on it. You can lay on your side, your stomach. Here's an advanced technique that my son is doing, and here's an older gentleman doing stepping on it as well. Best educational tool I found. And then the man or the doctor who created this tool also created a sitting tool called a balance sit. And it activates your core and your pelvic floor subconsciously. So we can really teach you how to activate what you need to in sitting. Here's a friend of mine sitting on the balance sit at a lake house. So here's my son and I. He's at the end of the triathlon in Pleasant Prairie. He overcame his injuries. He raced. He got 8th in his age group. Not first like he used to, but he was happy with his results. A couple years later, which was just a couple months ago, he is in top form and raced Chicago. He got 2nd in his age group, missing first by like 0.02 of a second, some crazy number. So he trusted his healing process. He embraced it. He worked hard. And when you embrace your healing journey and accept where you're at in life but don't let those limitations define you, don't know what you can accomplish. Last, I want to leave you with a couple of tips. Sleeping. If you sleep on your side, make sure you have a pillow that fits in your head so you keep it neutral. Don't sleep on your stomach because your head's turned all night. Movement, instead of stretching your neck like this, think about moving your body on your neck. Ice or heat is fine, doesn't matter which, and strengthen up your core. And make sure you move around the house and read my ebooks on how to take care of yourself through the day. Okay, and thank you for coming. If you'd like to discuss what's going on with you before you come in, give my office a call and we'll set up a free phone call with you. But if you're ready, give us a call and we'll get you scheduled. All right, I'm gonna, again, don't forget to put your first and last name in your email in the chat box. I'll send you a copy of this PowerPoint and a bunch of different ebooks, links to a bunch of ebooks. Okay. If you have any questions, let me know. So we're back on screen. I obviously close that. I can see you if you want to be seen. Let's see if there's any questions in the chat box.
Denise, I have a quick question. If anybody wants to, you guys are more than welcome to unmute yourself as well. it was helpful to know you said if you're doing treatment and it doesn't change after you've been doing it for 4 to 6 weeks, then it's time to try something else. That's helpful. But how long should you wait until you seek treatment? Like maybe it's you slept funny, you got a little crick in your neck, should you wait 5 days, 1 week, or do you think?
The sooner the better.
Mm-hmm.
There's no reason not to wait.
Mm-hmm.
For certain, now there's sometimes people will come in and so someone, let's say you slept funny and you're like just really stuck and it's just really painful up in your head, come in as soon as possible because we
Uh-huh.
usually can take care of that. And I've like with family and friends, I can kind of talk them through something online, what to do by video
Oh.
chat. But I can't do that
Oh,
if I don't know you.
okay.
So don't do that. But if you're having numbness and tingling down your arm, and it's coming and going, um, you may need to get to the doctor sooner. If you come in here and it's pain all the time, and after a few sessions, nothing's changing, I'll send you on to the doctor right away because we may need to get some imaging. We may need to get a shot. We may need a steroid pack.
Mm-hmm.
So it sort of depends on the symptoms, but there's no reason to wait. You can,
Mm-hmm.
you know, uh, if you are not on Medicare, you can come in and see me without a prescription. If
Mm-hmm.
you are on Medicare, you do need to touch base with your doctor and they're going to want to see you first.
So
So
you take, what do you take? You take Medicare and
I am in
Medicare?
network with Blue Cross and Medicare. And if
Okay.
you are out of network, we bill all insurance
Mm-hmm.
and my biller will work with you on how that works for
Great.
out of network.
That's awesome.
Yeah, and Medicare, all the Medicare Advantage plans, they're all different.
Yes,
But because I'm a Medicare provider, that's not an issue either.
that's good to know. Lots of hoops to jump through with that, so it's good to know that you can take them all. Okay.
Mhm. This is weird. Huh. Sorry, I'm looking at the chat box. It's like set up in a different way.
Oh, yeah, it always throws me off when like if there's a software update and it looks different.
Yeah,
It takes
yeah.
me a minute to get used to it.
It's
I
just
do see a
something.
message from Joanne. She does say thank you, very informative.
Yeah. Yeah, so I don't. Okay, I guess I don't know if that. Yeah, so sorry. It's not showing me all the different. I have to hit different buttons to get to all the different chats in there, which is interesting. So,
Oh, oh,
oh well. Any other questions? I apologize. All right. Well, everybody have a wonderful holiday season. And I'll hopefully see you next year.
yeah,
Stay warm. Keep moving. Take care of yourself.
yep,
Thank
yeah.
you, Denise. Thank you very much. Good to
You're
see you.
quite welcome. Amy, if you can stay on a moment, I want to make sure I got this chat thing saved. But everybody else, thank you for coming. I appreciate it.
you.
Perfect. Yeah.
Bye.
Bye-bye.
Bye-bye. See. I'm just seeing how it's saved.
I'm gonna
Where did it go? Neck pain, January 9th. What's today? Today is November. Oh, there it is. Okay.
13th.
All right, let's see here. I found it. Oh, interesting. Okay. It did save everybody's chat, but in order to see it all, I had to go on to separate places.
Oh, that is interesting.
What do you see? I see everybody. I see everyone.